Good evening, everyone, and thank you for joining us for tonight's COVID-19 Community Information Forum. I'd like to begin tonight by acknowledging the traditional custodians on the land and waters on which we meet today, and pay my respects to their elders past, present, and emerging, and any elders that may be present with us this evening. Now, tonight's meeting is being recorded, and I would kindly ask that you keep yourself on mute unless you're contributing to the meeting. So my name is Don Tidbury. I'm the CEO for DPV Health, Northern Melbourne's largest not-for-profit community health organisation. We provide an extensive range of medical, dental, mental health, allied health, children and youth, disability, family violence, social support, homelessness, refugee support and COVID response programs. I'm incredibly proud to say DPV Health has tested over 70,000 people and vaccinated over 12,000 people in our community since COVID began. I'd also like to acknowledge our wonderful colleagues from the Department of Health and Care Health and Community this evening. Ladies and gentlemen, now to the situation we are in. It's Victoria's 5th lockdown and the first lockdown with the Delta variant. The prevalence of the Delta variant in Australia and its impact around the world highlights the need for all of us not to become complacent. As a community, we have worked very hard together to control COVID, and we must continue to do so. Now, I must inform you that Victoria has recorded another 26 locally acquired cases today. Our key message to you and your communities remain the same. We ask that you please continue to follow public health directions, wear your mask, get tested if you develop symptoms, and please get vaccinated as soon as possible. So the format of tonight will be a series of short presentations by our guest speakers, followed by a question and answer session. We expect tonight to be concluded by 8 p.m. So I'd like to acknowledge our guest speakers tonight: Amanda Murphy, CEO of Connect Health and Community; Andrew Giles, Federal MP for Scullin; Fung Pham, Deputy Secretary, COVID-19 Response for the Department of Health; Mo Baptista, Director, Data of Intelligence, Modelling and Epidemiology for COVID-19 Response for the Department of Health; Mohammed Mohideen, Manager, COVID-19 Response Vaccination Program for the Department of Health. So ultimately tonight is to provide you information and to listen to your questions and address your concerns. Please post your questions in the chat if possible, or raise your hand and we will come to you. We ask that you keep your questions short and sharp so that everyone has a chance to speak. Our engagement team will also be sharing relevant resources and information in the chat during tonight's forum. Our engagement team can be reached directly via the following email address: rapidresponseengagement@health.vic.gov.au. So I'd now like to introduce Amanda Murphy, CEO for Connect Health and Community. Welcome, Amanda.
Thanks, Don, and thank to each and every one of you for being here with us this evening. Connect Health and Community acknowledges the traditional owners of the land and the custodians of the land on which we work, the Boonwurrung people. We pay our respects to them, their culture, their elders past, present, future, and uphold the relationship to this land. For those of you that are meeting us for the first time, Connect Health and Community has been providing primary care services and social support to the residents of southeastern Melbourne, particularly around the Bayside, Glen Ira and Kingston local government areas for over 45 years, and a similar range of services as Don outlined that DPV deliver. People attending tonight from the Bayside, Glen Ira and Kingston local government areas, we have testing centres operating extended hours through to Tuesday evening to coincide with our hopeful easing of lockdown restrictions. So very quick summary. Sandringham Ambulatory Care Screening Clinic, which is at the rear of the Sandringham Hospital in the rear car park at 193 Bluff Road, Sandringham. Its hours are 9 a.m. to 8 p.m. The Brighton Public Golf Course car park at 230 Dendy Street, Brighton, it's open from 8 a.m. to 8 p.m. Both sites have done record numbers of tests over this last week, and it's been an incredible effort from those team members. We have other testing sites, Springers Leisure Centre at 400 Cheltenham Road, Keysborough, open from 9 to 8. Monash Health 133 Wellington Road, Clayton, open from 8:30 a.m. to 8 p.m. And additional lanes are operating at Monash to support additional testing demand. There's also a new site that's opened up at the Kingston Heath Reserve car park, which is 299 Centre Dandenong Road, opposite the DFO. For those of you that are familiar with that area, 8:30 to 6 p.m. daily. We have COVID vaccination locations at Sandringham at 193 Bluff Road, Sandringham, that's open from 9 to 5, 7 days a week. It's achieved a milestone of 13,000 vaccinations since it opened on the 9th of June. Please be aware that also there are the larger testing sites such as the Sandown Racecourse at 591 to 659 Princess Highway, Springvale. It's open from 9 a.m. to 5 p.m. Like most testing sites, the booking online via coronavirus.vic.gov.au or call the 1800 675 398 phone number if you'd prefer to book via the phone, or if you're booking on behalf of dependents and family members. We're opening our first mobile vaccination unit in partnership with Central Bayside Community Health Services next Tuesday at Murrumbina for vulnerable residents residing in City of Glen Eira. And we'd like to thank everyone for their support, not only for tonight, but for every night during this lockdown. Our thanks to our community, our local state government partners, Don and your team at DPV, and we acknowledge how important that this support is and how valuable it is to all of us. So thank you.
Thank you, Amanda. I'd now like to introduce our much valued federal member MP for Scullin, Mr. Andrew Giles. Welcome, Andrew.
Look, thanks very much, Don. It's a real privilege to be part of such an important conversation, and I'd like to start my very brief participation in it by acknowledging traditional owners. I'm on Wurundjeri land, and it always will be Wurundjeri land, and I pay my respects to elders past, present and emerging. Look, we've just heard from Amanda. We're going to hear from Fong, Mo and Mohammed, and they've got really important information to impart. So all I really wanted to do was to say a couple of things. Firstly, Don, to acknowledge the amazing work that you and your team have done for the people that I'm privileged to represent, particularly over the last 18 months or so, where it's been an incredibly challenging time. And I think the work that you've done and the way that all of you've done it has been absolutely invaluable, not only at keeping people safe in the community, but keeping people connected, which is, I think, the two themes that really tonight is all about. And for me, for all of us in Melbourne, as we go into this fifth lockdown, we think about what this period has meant to us and what it has taught us. And I know in the northern suburbs, while we haven't been as affected this time round, we bear the scars of the previous lockdowns, and so many people are feeling exhausted and frustrated. And that's why I think it's important to come together in this forum to get some more information from experts and to really impress upon everyone a couple of messages. And for me, the messages are this: we are in a good position as a community because of the choices we've made, the choices experts have guided us towards as a society, and the choices we've all made as members of the community to keep ourselves safe and to keep those around us safe. And we know with the Delta strain how important that is, how important it is to carefully follow the public health advice. The bit that goes with that is to recognise that different people are dealing with this differently. And the other thing we can all do, particularly those of us who have positions of authority and leadership is to make sure that we're not leaving anyone behind in recognising that for some people, this has been and will be a very tough time. So let's acknowledge that when we feel frustrated. Let's look out for those around us as we look to do our part by following the public health advice. And if I can just end by saying two things, and they're both thanks. The first thanks is a broader one than just to DPV, to all the essential workers, healthcare workers, but everyone else who's kept things going when the rest of us who are fortunate enough to be able to work from home have been doing that. So for the teachers, the delivery drivers, the supermarket workers, and for everyone who's been out there putting themselves at risk to make sure we can all go about our lives, I say thank you. And to everyone in the Melbourne community, particularly those who I'm privileged to represent, every day I'm in awe of the sacrifices people are making to keep those around us safe. So thank you very much for that. Let's keep this going, and I really look forward to hearing from the department and others over the course of this Zoom tonight. So thank you very much, Don, for giving me this opportunity too.
Thank you, Andrew. We greatly appreciate your support. Look, we're now going to move to Fung Pham. Fung is the Deputy Secretary for COVID-19 Response for the Department of Health. Welcome, Fung.
Thanks very much, Don, and thank you very much also, Andrew, for all your comments as well. And I completely and heartily endorse all those comments you made about the role of all of us in ensuring and supporting the COVID response and our attempts to return to a more COVID-safe future. And first, just like to acknowledge the traditional owners of the land on which we're meeting and pay my respects to elders past, present, and emerging. I also wanted to acknowledge the role of all of us in through what has been a quite difficult period, I think, for many of us through the last 18 months of this pandemic. It is obviously an exhausting and difficult circumstance being in multiple lockdowns over a period of time. But those lockdowns we have shown are an effective mechanism to help combat what is unfortunately can be a dangerous virus. And we've shown before that these lockdowns can work in terms of basically bringing those transmission rates back down to zero again, which is where we want to be so that we can return out to our lives as much as possible. And so all of us have a really big role to play in that, because if all of us do participate in terms of maintaining the correct rules and obeying all the restrictions, that gives us the best chance of moving out of lockdown as quickly as possible. So in terms of, and I think somebody's going to be sharing some slides so I can give a little bit of an update on the current situation in terms of the pandemic.
Yeah, thanks, Paul. I'm just trying to get permission to share my slides. Rick, are you able to give me permission to share my screen? Or the host?
I think Riaz.
Yeah, Riaz can do this for us.
Eddie is doing that right now.
Great, thank you so much.
Okay.
Apologies.
Cool. So while that comes on, I might just give a couple of little updates, and then the slide will sort of illustrate what I'm talking about. So as Don mentioned, today, at the beginning of the day, there were announced there had been 26 new locally acquired cases. So of those, they've all been linked to the current outbreak, which is a good thing, rather than ones which are unlinked or unknown sources of transmission. In addition, the other thing, which is a bit of a green shoot in terms of how this lockdown is proceeding, is that 24 of those 26 people were already in isolation when they're during the course of the infectious period of the virus. So what that means is that as a response, we're really starting to catch up well with the virus, because we are actually managing to ensure that people are in isolation by the time they're actually infectious with the virus. And that's really important for us to be able to get ahead of the virus and ultimately to move out of lockdown. If ultimately everybody who's infected with the virus is in isolation, then it reduces the risk that they can infect anybody else and for the outbreak to continue. So those are really, really important things around, and that's one of the important things about the follow-up, the case, the contact tracing that we do, and the follow-up with people who might be potentially exposed to the virus. If we lock down those people and put them into isolation as soon as possible, that reduces the risk of onward transmission. So the other things that it's worth noting from this is that we've reached a total of 146 active cases so far in this outbreak. So it is a reasonably large outbreak, not as bad as the second wave last year, but it is a reasonably substantial outbreak, and obviously we want to damp it down as quickly as possible. We've also had very, very large numbers of tests received over the last over the last couple of days. And that's a really good testament to all of you who've gone out and get tested, which is a really important part of getting the outbreak under control. Because if people get tested, even if they've got the slightest of symptoms, it means that we can make sure that they aren't infected, or those who are infected, we can detect it as soon as possible. So I think 2 or 3 days ago, we actually had the highest number of tests a day that we had ever had during the course of the pandemic, which was about 59,000 tests, I think 2 or 3 days ago. We've come down slightly from that number but it's still a very solid number of tests being undertaken every day, and 43,000 test results were received yesterday. The other thing that's probably useful to point out is that test results are also being delivered very quickly as well. So if you have any concerns about how long a test result might take to come, we have improved the performance of the systems considerably compared to last year. And now the vast majority of tests are returned, test results are returned within a day of somebody undertaking a test. If we move to the next slide, I can give a bit more of an overview of lockdown restrictions. Now, many of these will probably be very familiar to all of you already, because of course we are familiar with being in this situation, unfortunately. But there are, as for the last lockdown, only 5 reasons for leaving home. The first of which is for shopping for necessary goods or services, such as essential food. The second is for caregiving or compassionate reasons. The third is for authorised work or permitted education. The fourth is for receiving a vaccination, and the fifth is for exercising, but only up to 2 hours per day. And it's really important for all of us in the community to really adhere to these restrictions as much as possible, and completely, because these are the ways that we reduce movement in the community and reduce opportunities for the virus to spread. In addition, there is a travel limit of 5 kilometres from your primary residence, except to return home or to visit an intimate partner or a person in your single bubble. So it's really important that we obey these restrictions so as to reduce the risk of the virus being transmitted further. If we move to the next slide. So here, and you'll all be able to read some of these, that there are a range of other restrictions in place. Again, these are essentially the same as from the 4th lockdown. Particular things to note from this, I think, are that we can't have private or public gatherings. That there are no in-person religious gatherings or ceremonies, though online ceremonies are possible. Also, some of the things and we recognise this is really difficult for people in communities, that some of those events, such as funerals, we have to restrict the numbers of those and restrict weddings as well. We recognise this can be very, very difficult for people, but those are the sorts of events which unfortunately can turn easily into super spreading events, which is why we have to restrict them quite heavily. The other thing, of course, is that face masks must be carried at all times and worn indoors and outdoors, except if you're at home. And again, this is a really important measure because when people wear face masks, the risks of transmission are reduced significantly. If we go to the next slide. So this is a bit of an illustration of what has been happening in terms of testing over I think it's over the last 2 months. And what you can see here is that just over the last week or so, we have really significantly increased testing numbers across our community. And this is a really important part, as I was saying, of our COVID response. If we test as many people as possible, then we are able to detect where the virus is. And the more that we're able to detect where the virus is, we can make sure that all those people are isolating safely, and therefore we can reduce the risk of onward transmission. So high testing numbers are essential for us to both to isolate people who are positive with the virus, but also to give confidence to our public health professionals that we have identified every possible case in the community. Because of course, what we need to do is minimise and ultimately drive down to 0 those cases in the community, and that will allow us then to safely reopen. If you move to the next slide, then. So reiterating that message about testing, we've just put up on this slide here a number of the key sites for which you can get tested. There is a fuller list of these across on the health website, and I think the team can drop into the chat that link to those testing sites. The other thing which is really important about that list, which is on our website, is it also gives some sense of both of opening hours, but also queuing times at each of those sites. So on a day like today, when it's quite cold and it's quite challenging, having a look at that before you go out to get tested gives you a sense of how long you might need to wait. Over the last couple of days, the waiting times have dropped quite a bit, so it is possible to get tested and in and out quite quickly. The other thing I should flag, of course, is that if you need to go further than 5 kilometres to go to your nearest testing site, that's something you can do, of course. The other thing worth noting there is that generally in the evenings, the testing queues tend to be shorter. So again, if you don't want to avoid having to wait too long, then going later in the day is better than earlier. The other thing I should emphasize is really it's very critical for all of us that even if you've got the mildest of symptoms, the importance of getting tested. So you might only have a headache or an itchy throat, something like that. In many cases, COVID might manifest itself with only quite mild symptoms. But unfortunately, and that means why people with mild symptoms, it's really important to get tested. But unfortunately, for a number of people, those mild symptoms can then turn into something a more critical disease. And one of the things that's happened, and is unfortunately quite observable in the New South Wales experience, is that the Delta variant, which we're currently experiencing, can result in a high rate of hospitalizations. And some of those hospitalizations are occurring with people who with previous variants of the virus have been less affected. So people who are younger. There are a number of people in New South Wales who are in, for example, in intensive care units or in hospital who are in relatively younger age groups, such as under 40. So it's really important that although for some people this virus can be mild, for other people it can be quite severe. And so for all of us, we do need to make sure that we do get tested if we have even those mild symptoms. If we move to the next slide then. So just returning to the key themes of what I was saying before, these are some of the key things we must all do as a community to ensure that we can drive down transmission rates as much as possible and ultimately move to a safer future. First off, really getting vaccinated. So if we want to move beyond these lockdowns and this current mode of a state of emergency, we need to get vaccination rates as high as possible. So really what we need to do is for everybody who's eligible for the vaccine, it's really important that you get vaccinated so as to protect both yourself, but also your broader community, your family and your friends, and to protect you all from both serious illness and risk of death. Secondly, it's really important for us to follow COVID safe behaviours. So this means wearing a mask when required, and at the moment that includes both indoors and outdoors whenever you're outside your home, but also washing your hands and observing other hygiene as well to make sure that you're minimising the risk of transmission of the virus. The third area is around QR codes. So this is about making sure that, and many of you will have, and most of you probably have already seen the QR codes, which are located in every shop now, every shop and every retail setting, and indeed most all offices and a whole range of other areas now required to have QR codes. These QR codes are an important part of us being able to contact trace people quickly. So if you check in using a QR code, it means that if somebody at the same time or around the same time as when you visit turns out to have unfortunately been infected with the virus, it means we can then follow up and contact you really, really quickly. And of course, if you have been at risk of exposure, one of the things that all of us would want to know is know that we've been exposed as soon as possible. And so those QR codes are things that allow that follow-up to occur as quickly as possible to protect ourselves and also our broader families as well. It's important to flag that those QR codes are only used for contact tracing purposes. They aren't used by any other parts of government. They're not used by immigration. They're not used by the police. They're not used by other parts of government at all. They're purely used for contact tracing purposes and to enable us to contact people if they've been at risk of being exposed to the virus. The fourth area is around testing. So as I was saying earlier during my presentation here today, it's really important that all of us, if you have even the mildest of symptoms, to get tested so that we can find COVID-19 quickly. And the final one is if you are infected with the virus, or if you do contract COVID-19, or if you are a close contact, then it's really critical that you isolate at home. So, and follow the instruction given to you by the Department of Health so that you don't put anybody at risk, whether your friends or family or other people in the community from COVID-19. And the really critical thing is if all of us are following these rules and these restrictions as much as possible, that provides us the greatest chance to be able to stamp out the virus quickly and return to a more normal life. So thanks very much for listening to me for those slides, and I'll hand over, I think, to Mahana, who is from our epidemiology section.
Thank you, Tom, and hello, everyone, and thank you for attending this forum. I'm really happy to be here and talking to you a little bit about the epidemiology behind, the current outbreaks that we have in Victoria. the screen that you're seeing here now is just giving you a little idea. It looks like a very colorful chart, but what it's doing is it's looking from the 12th of July, when we had our first cases that were diagnosed for us, how the cases have built up over the coming days. And we've literally gone from a couple of cases in the first days to 26 cases yesterday. So in the course of the last 10 days, we have had 133 cases, and all of these are linked back to the outbreaks in New South Wales. As Fung had mentioned, these are all associated with the highly transmissible Delta variant of concern. And really what makes it, if you see the different colors on this chart, it's really showing how these cases have been linked to different outbreaks. The good thing is that all our cases right now are linked. And the reason why that's important is that we know who's got it and who they've passed it on to and where it's coming from, which makes us feel a little more comfortable that we're not missing something. But again, unless we're really encouraging that message about getting tested, that's really important. Currently, we've got 31 outbreaks that are linked to active cases, and the outbreaks are in many different settings, mainly around, we have some community settings like the City of Hume outbreak. We've had the large sporting events like MCG and Amy Park, which again give rise to a very large number of contacts that are also generated through these cases. We've had a lot of schools that have been involved this time, including, the Bacchus Marsh Grammar, which is sort of more regional, but we also have a lot of metro schools like Trinity Grammar and St. Patrick's, etc. So quite a number of different settings in which, we have had these outbreaks. But so far, as I said, it's really good that we're linking them all up. Mia, do you think we could go to the next slide, please? Thank you. So this chart is important because it's showing us the case locations. And as you can see, and it's not surprising, that most of our cases are always focused around the northeast and the western suburbs, with some spread in the southeast and also in the regions which you don't see here. And I guess what this really shows is that unlike a lot of other times in the past, this is spread quite evenly across Metro Melbourne. But we also recognize that, particularly in the northern suburbs, people are tired because, we've had to do this. This is, we're doing this, as Fung mentioned, this is our 5th lockdown. Everyone's a bit exhausted, but, we are really seeing that, it is focused around, some of the suburbs where we have to encourage the testing. If we can go to the next slide, Mia. And I guess this is a slightly more complicated slide, but what this is showing really is, the different LGAs which are impacted. And you can see there's a very large number, and also the different languages that are spoken at home. So, we've got everything from, English, Arabic, Bengali, Gujarati, Urdu, Italian, which really means that it's sparing nobody. And we're not really focused on any one single community. It is impacting all of us. And the fact that we have so many different languages as well and different LGAs involved, which means that the engagement that we have with our community is so important as well at this time. If we can go to the next slide, Mia. In this, we're actually seeing the spread of exposure sites. We've had 323 exposure sites since the 12th of July, and that's a very large number of exposure locations. The concentration again is in Metro Melbourne, but it's all the way up to Mildura on the top part of this chart, to the best of my knowledge. Yes, that is right. So lots of different places where we have contacts that are being followed up, a lot of people that are isolating at home effectively, and a lot of testing happening in all of these suburbs and LGAs. And I'll probably talk to the last slide right now, which is the next one. So talking a little bit about the Delta variant, the biggest difference, we're actually seeing that all of the cases that we've had since the 12th of July, and also the 2 cases on the 24th of June, they all are the Delta variant of concern. And the main challenge with this is that it is far more infectious than the Alpha variant and also the other strains of the virus. So therefore, in a single household, if one person gets it, everybody else is more likely than not going to get it. So there's a lot of, I guess, people are encouraged, if they are a case, they are encouraged to actually isolate in hotel quarantine if they can't isolate from the rest of their family members. So what this does is that the more infectious it is, the harder it is really to control. And because you get more numbers of cases, the likelihood then of hospitalization and infection and therefore severe disease is higher. And so far our vaccinations are both effective against the Delta variant, the AstraZeneca as well as the Pfizer, even though they're different levels of effectiveness, but they are effective against severe disease. Both of them are equally effective when it comes to severe disease. So back to basics, wearing masks, your hand hygiene, your social distancing, and using the QR code. So check in everywhere you go so we can actually contact you and we can protect you and let you know, and we can protect the community. I think I'll leave it at that, Mia, but I'm happy to take any questions. Thanks. And I think we're handing back to
yeah, so what we'll move on now to Mohammed Mahideen.
Thank you.
Mohammed Mahideen, Manager COVID Response and Vaccination Programs.
Thanks, Don. So just to give you an update of where we sit with the dosages, there's over 10 million doses given in Australia. Like if you look at Victoria, there's over 2.7 million. Mia, if you just click on the slide, it'll come up.
I have. Can you not see the slide there, Mohammed?
I can see the slide here. If there,
yes. Oh, sorry.
So over 2.7 million doses have been administered in Victoria, and if you click again, it'll give you the world. So 3.7 billion doses, 26% of the world population at least has had one dose. If you move to the next slide, please. So 1 in 3 Australians of the age of 16, or 34.1% of eligible population, has had one dose. Of these, 12.5% have received both doses. In the age population, 25% have been fully vaccinated. So in Australia, over 5.5 million doses of AstraZeneca have been given. In Victoria, of the 2.7 million, 1.1 of Pfizer and 1.6 of AstraZeneca have been given. Next slide, please. So advantages of getting vaccinated: COVID vaccines are effective. They can keep you from getting and spreading the virus that causes COVID-19. The vaccines also prevent you from getting seriously ill, being hospitalized, or being in the ICU. Getting vaccinated helps not only protect yourself, but protect the people around you, particularly those increased for severe illnesses as well. COVID-19 vaccine will not give you COVID-19. Also, there's scientific evidence to show that people who have been vaccinated prevent the virus from mutating and giving rise to new virulent strains. So the ATAGI advice on the 17th of June was very clear that those under 60 to be given Pfizer and those over 60 to be given AstraZeneca due to the TTS. Anyone under 60 who wants to take AstraZeneca needs to consult their GPs and have a proper understanding and make an informed decision on that. So since the outbreak that took place in New South Wales, ATAGI again reviewed the use of AstraZeneca, and the decision was the same. People under 60 need to be given Pfizer, and people over 60 need to be given AstraZeneca. They also made certain changes. Sorry, next slide, please. Sorry. Next slide. They also made certain changes about the duration between the first dose and second dose. In the case of outbreak, that they could reduce the gap of 4 to 8 weeks between the first and the second dose in place of the 12 weeks. In the normal circumstances, it is the 12 weeks. Again, people over 60 been vaccinated, it outweighs the risk of TTS in this age group. Again, getting vaccinated, my final message is getting vaccinated is important. It's important to get both doses for the efficacy of over 90%. Both vaccines have been found not only in Australia, worldwide, that is effective against the Delta strain. We are still vaccinating people on priority basis because there's still a limited supply. As the supply increases, there might be a change in the mode of vaccination, in the number of people getting vaccinated. If you have been to a tier 1 site or you are a primary contact of an infected person, you should get tested and quarantined before getting vaccinated. Please don't, if you are one of these people who live in the same household of a person who is infected or a person who has been identified as a person who has visited a tier 1 site, please do not go and get vaccinated at this stage. You must get tested, make sure that you're negative and follow the quarantine procedures that is required. If you're already infected and are not showing symptoms at this stage, the vaccine will not work against the infection. The vaccine is there to prevent you being infected, not to treat the infection. If you have had COVID, it is recommended that you wait for 3 months before getting vaccinated. I think that's the last slide. Thank you. Happy to take questions.
Look, thanks, Mohammed. I might hand over now to Mia Bromley, Director Rapid Response Testing and Engagement for the Department of Health. And Maria's going to run tonight's question and answer session. Welcome, Mia.
Thank you very much, Don. Thank you for that very kind introduction. And I'd also like to pay my respects to Aboriginal people. I'm on the land tonight of the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to elders past, present and emerging before we get going. So look, the way this Q&A will work is that I will read questions from the chat. We might get to some of the hands up, maybe after we do a few from the chat, and I will go to my colleagues who are also on the call to answer the questions. I might just start with the question that's right at the bottom, and then I'll work my way back up because I can see there are quite a few in the chat. Someone has asked the question, a colleague from work has a daughter who attended a local gym at the exact time of transmission. So that might be when there was a case in that, that gym. Her whole family are isolating as tier 1 contacts and told they will receive calls, but they haven't yet received a call. So Fung, I'm not sure if you want to take this one, but I think one of the things that we have found over this outbreak is that our contact tracing teams are getting through lots and lots of new exposure sites every day. And sometimes it can take a little while for our teams to get to people.
Yes, no, that's absolutely right, Mia. So it is unfortunate that the rate at which the number of primary close contacts have been identified has been very, very fast in this outbreak because of some of the exposure sites such as the MCG and Amy Stadium and also some of the schools. And what that means is that we have more than 19,000 primary close contacts now on our books in terms of people who need to isolate. That's a much higher number than we've had in any other outbreak than we've had before. So unfortunately, that does mean that is taking a while for the teams, and we've expanded the size of this team very, very significantly in a short period of time. But these teams are working as fast as they can to contact everybody who's a primary close contact. But because of the sheer number of people who have been identified as primary close contacts, it's hard to identify, to phone all of those people very quickly. So it does mean that if you are isolating, you will need to rely on the advice on the Department of Health website in the interim, in the meantime, and we do encourage you to follow that quite closely. I should also flag, I think there's been some commentary here about some of this advice is quite complex, particularly for the MCG exposure site, and it has changed over time. One of the reasons some of these exposure sites, unfortunately, one of the things we have found through the course of this outbreak is that people who we thought were at low risk of getting infected turned out to be at higher risk of getting infected. So the Delta strain has turned out to be a more infectious strain than, unfortunately, the previous strains. And this has meant that over time, we have had to change the exposure site advice on places like the MCG and AAMI Stadium. And so that might be one of the causes of a degree of confusion about why it is that initial advice might have been one thing, but then it changed to something else. It's because, unfortunately, it's turned out that some people got infected in places which we previously thought would have been unlikely, but which have unfortunately turned out to be more likely. And so we've had to change the advice in relation to that.
Thank you, Phil. That's a great answer. There's a couple here about vaccinations, so I might try and group them together if that's okay, and I'll ask Mohammed to answer them. So one of them is, when do we foresee vaccinations opening up to people aged under 40 years?
Yeah, that's a good question. The answer is when we have sufficient supply. And once I think we should be getting both Moderna and Novavax towards the end of the year. So I think we are expecting a big supply of Moderna somewhere in October, and also a larger supply of Pfizer that would then give us abundant supply to then be able to vaccinate people under 40, hopefully. Yeah.
Great, thank you. And there's another really great question. So someone's had their first dose of AstraZeneca, and they know that the second dose is we recommend after 12 weeks, but they want to know how much immunity they have after 2 months from the first dose, so maybe around 8 weeks after the first dose.
So the research research shows that after the first dose, after about 2 months, you normally get an immunity of over 68%. And as time goes by, you build up that immunity. And after the second dose, you'll have over 90%. So that's why initially, if you look at the studies done and the vaccination schedules in UK, they initially gave it after 1 month. Studies show that the longer you kept between the 2 doses, it built up more immunity. So ideally it would be the 12 weeks, but as Atagi has mentioned, that if there's a major outbreak, you could reduce the period to 8 or 4 weeks. Yeah.
Great, thank you, Mohammed. There's a question here. Someone had their first dose of AstraZeneca but felt quite unwell after that dose, and wonders what they should do next. Should they have the Pfizer dose for their second dose?
Thanks for that. I was just typing a response to that person's question. I think you need to consult your GP and I think get their advice. And with the help of the GP, you can submit a form to VIXIS. I'll put all the details up on the website. And VIXIS will make the decision whether you should change your vaccination depending on how severe this reaction was to the initial dose.
Excellent. Thank you, Mohammed. And I'll do one more vaccination one, and then we might go to some other questions because there's some really great ones in the chat. So there's a really good question here. What are some of the strategies that have successfully worked to persuade people to get vaccinated?
Okay, great question, and I can answer to that. We have been engaging with the community over the last few months. I have done over 58 information sessions with various communities. So we do roughly a 1 hour session where we present for about 20-25 minutes. We take questions because the way we approach this is reach out to the community, engage with the community, find a time that is suitable to get the community on board. And we have these sessions either face-to-face or online. And we address not only how the vaccination program is working, but also address their concerns, the myths out there, the myth busters that, and thereby we build confidence in the people then to go and get vaccinated. We're also following up with those communities to sort of get them to organize maybe a session to go in a group to get vaccinated. And there is a move for us to look at having special days for special groups of people or other communities to go as a whole to get vaccinated as well. So lots of engagement is taking place and we are continuing that dialogue with the community.
Yeah, that's a really great answer. Thank you very much. There is a question here. Someone has symptoms but doesn't drive and wants to know if they should take public transport to their testing site, or is there a service for testing to be organised at home? Do you want me to do that one, Fong, or would you like to answer that one?
If you've got, because you've got information about the call to test service, don't you?
Yeah.
Yes, how about you answer that, if that's okay?
So that's right. So there is a service called Call to Test, and you can access that by calling the hotline, and my guys might put the link in the chat, Obviously, it does have some limitations, that service. So there are some criteria for that service. But I would also suggest that if you don't drive and there's no walk-up site near your home, that you could contact potentially your GP, your local GP, or your local community health centre, depending on where you live, and they might also be able to help you get a test. As well as the call to test option, I'll just get my guys to put the where to get tested link into the chat. And there are many, many sites that are walk-up sites, so that might also be an option for you depending on where you live. Great. There's another question here, and this one might be for you, Fung. If a primary close contact tests negative and other family members of the primary close contact are secondary close contacts, how long do they have to stay in quarantine or isolation?
Yeah, no, thank you. Thank you for that question. And that's a good question. You still have to stay in quarantine for 14 days if you are a primary close contact or your family members of a primary close contact. The reason for this is that in some circumstances, or for some people, COVID-19, it incubates for a period of time. So it sort of, it lurks in your body without growing further, I suppose, I'm trying to use the right words, without becoming fully infected for a period of time. And sometimes that can take quite a long time before that emerges. The evidence is that it can take up to around 14 days. So basically, we need to make sure that people stay isolated until those 14 days have passed, to make sure that it doesn't turn up after in the later part of that incubation period. We have had some cases just in the last couple of, during the course of this outbreak, where people were infected in, I think, the MCG and AAMI Stadium, where essentially the virus stayed in their body and incubated for a number of days, more than 3 or 4 days, sort of like 7 or 8 or 10 days, and only emerged when they had their day 13 tests at the end of their isolation period. So it's really important. Those are examples of people for whom it was really important that they stayed isolated for those full 14 days. And that's why we require that anybody who's a primary close contact has to isolate for 14 days.
Fantastic. Thank you, Fung. There are quite a few questions in the chat. We won't be able to get to all of them, but I'd really love to hear directly from some members of our community. So there's a couple of hands up, and FM Maguire, I think you had your hand up for quite a long time, so I'll go to you first.
Thanks very much. I was on the phone, that's died. I've come back on the iPad. So I just wanted to quickly say to everybody, this is fantastic. Thank you. The community connection is vital, particularly in the north. We know that the virus stalks inequality. So people who are poor, who have got insecure work, who are from high migrant or refugee communities are really vulnerable. And that's why to be able to have these sorts of meetings, get it right down into the community, make the connections. Can't thank you enough on behalf of the people that I represent as the member for Broadmeadows. Also want to give a sense of hope for the future. Don Tidbury's there, who's from DPV Health, and Don's aware of this. We've got $60 million for a Centre for Excellence for Health in Broadmeadows to look at how, the future, how we build this, how we get the nursing, how we get the jobs right, and how we also get to be able to connect to everybody from what is virtually United Nations in one neighbourhood, people from 160 different nationalities. So that is vital. And then also just to be aware on what's coming. Remember, there are 50 million AstraZeneca vaccines being manufactured by CSL in Broadmeadows. And the Victorian government's put $50 million on the table as a first bid to try and win the mRNA manufacturing. So that's the next generation manufacturing of vaccines against not just COVID-19, but also against cancer and another range. So I just wanted to give you that sense that the government is working at a whole range of different levels, from grassroots to the national set of circumstances, and then even internationally as well, to get that done. So thank you on behalf of the people of the North, and Andrew Giles and other MPs and everybody else who've been on here as well. We're trying to do it at our level, but for those on the front line, for all of you who are doing this and coordinating. I know it's been exhausting. I know people, the nerves are frayed, but if we can just give you that encouragement that you know that we've got your back, we are putting the investments in, we're doing the big picture strategy as best we can and as fast as we can. I'll just make the point that there's not a political point is on the record. It's more than 5 weeks ago, I called for the vaccine rollout to be supercharged. So let's get the jabs in arms. That's our best way through this. And hopefully we can get that coordination right and make sure that the people that we represent, the people who are most vulnerable, are taken care of as soon as we can. So if there's any feedback you want me to do, send it straight through to my office. I know Seta from my office is on this call as well, and we'll get the message out as fast as we can, and we'll keep following the science and the evidence base, and this will be our best protection and our way through. But stay strong, keep going, everybody. We're getting there. I know it's wearisome, and I know it's threatening, and I know it's people feel, we've all got families, we've got to take care of them as well. But I just can't thank you enough for your dedication. Thank you.
Fantastic. Thank you, Frank, and great to have you with us tonight. I'll go to Tonya. Tonya's got her hand up as well.
Thank you, Mia. Thank you, Mohammed. Quick question regarding tier 1 exposure side. The parents are in isolation. They've been tested negative, both. So is the children. It's been 10 days. Do they still need to continue on the 14 days in Moreland area?
Great, thank you, Tonya. I might actually ask Mahana, our epidemiologist, to come in on this one. Mahana?
Hi, Mia. Thank you. And thank you for the question. So if you are a tier 1 primary close contact, you have to isolate right through the 14-day period. You will also need to have a day 13 test, and based on the result of the test is also part of your clearance process. So, but even if you're at day 10, if you're a primary close contact of a tier 1 exposure site, 14 days is your quarantine period.
Thanks so much, Mahana, and thanks, Tonya, for the question. Great one. I'll go to Marion. Hi, Marion.
Is it me, Mia, Mom?
Oh, hello, how are you? Great to see you.
Yeah, I'm regular here now. My question is, we're hearing people that are testing positive after 14 days of quarantine. Does that suggest that 14 days wouldn't be enough, really? Or will there be some feeling of suspicion that 14 days is not enough? And when you test positive and you have been infected for 5 days, do you still need to wait for 14 days? Perhaps you have been tested late or been exposed more than 14 days altogether. So you tested at day 5, and that's the time that you submit yourself for testing. Do you still need to wait another 14 days to isolate? Because the keyword seems to be 14 days. When do you start counting the 14 days?
Oh, that's a great question, Marion. All really good questions in there. And I think they're very much questions for Mahana.
Thanks, Mia. So again, we're back to the 14-day question. And the reason we're taking this 14 days is we're taking that as an incubation period. There is clearance criteria, which is specific to each case as well. So you have to be clear, you have to have served your 14-day isolation period from the time of your diagnosis. And it's different if you're a close contact and you're going through your isolation period and then you actually develop symptoms later and you test positive. You still have to wait through the 14-day period from your initial diagnosis date. You also need to have you have to resolve your symptoms have to be resolved, and you have to be well before, and you have to have, there's no clearance test for this, so it's just waiting out that isolation period. But yeah, you do have to wait it out, unfortunately. There's no other way.
Thanks so much, Mahana. Look, there's a couple of really great questions in the chat that I want to get to, but I might go to Anita first. Anita, you've got your hand up.
I do. Thank you all for this amazing forum. My question is one that's come from a colleague today who went onto the COVID website and checked his eligibility using the eligibility checker, and he came up as being eligible for a COVID vaccine. So the next step is to find out where you can get your COVID vaccine, and there was nowhere that he was able to book in to have his vaccination, and that all the areas were completely booked out. So what my question is how often are the websites updated with the information on the supply of vaccines and the availability to get vaccinated? So it's about access to vaccines for eligible people.
That's a great question, Anita. And I think Mohammed will be able to answer that one for you. Thank you.
Thank you very much. Thanks, Anita. I think what happens is that sometimes the supply is not as much as the demand. And like when your friend rang up, they've given him maybe a date in a few weeks' time when they know the supply, but the supply keeps coming every week. So as the supply comes and as people book in, because we are also not only vaccinating the first dose, we are also giving people the second dose. So there is a reason to keep some of the doses ready for people who need the second dose, within that certain period. The good news is we know that now lots of GPs have come on board, so GPs also can vaccinate. Yeah. So if you go to the website, there's a list of GPs and a list of sites that offer the vaccines as well. So it's a matter of, I think, ringing around, because maybe some places might have some stock in place as well. So I would suggest that your friend just books in whatever appointment he gets now, and then maybe look as time goes whether there's some vacancies coming in.
Fantastic. So thank you, Mohammed. I can't see any more hands up, and I know that Mohammed's been answering some of the questions and others and have been answering the questions in the chat. There are a couple of questions in there in different places about the way the Department of Health is engaging with multicultural communities, and maybe I'll start off with a couple of ideas, but I might also throw to Fung and Mohammed on this one as well. So we work closely, very, very closely with the Victorian Multicultural Commission and other organisations that work with multicultural communities. And I think it's been one of the greatest strengths at different times in our COVID response, those partnerships we've had with organisations like DPV Health, Connect Health, Victoria Multicultural Commission and others, to deliver programs and translated materials for our multicultural communities. But I wonder whether Mohammed or Fung might want to talk more specifically to some of the activities that you're doing in relation to vaccination or other activities to address that question. Do you want to go first, Mohammed? You've probably got a few.
Okay, so we are engaging a lot with VMC and multi-faith advisory boards as well. And we are reaching out to lots of communities. So the engagement strategy is that we work with the most vulnerable communities, the small communities, the new emerging communities. We are reaching out to them first so that we can talk to them and advise them. We are also have a program called the Champions Program, Cal Champions Program. So when we do talk to any of these particular groups, we also take with us a doctor or a Cal person who can speak that language, so we can address the questions. Like, for example, this afternoon I was talking to an Arabic-speaking community, and so I had a person who was interpreting while I was speaking. So the session went a little longer than normal, but that's the most effective way of getting the message across. So we make people comfortable so they can ask the questions in the language they're most comfortable with as well. Yeah.
Fantastic. Now, I have just realised it's 1 minute to 8, and I did promise that we'd finish on time. So I might just hand back to Don, if that's okay, to close us out.
Look, everyone, we've had up to 250 households on tonight's call, so I think we can all agree it's been a really worthwhile event. I'd like to call out our great thanks to our guest speakers and our teams from DPV Health, Connect Health and Community, and the Department of Health for their great work in making tonight happen. Look, I think the key messages we can take from tonight are please follow the public health directions, get tested if you have symptoms, and please get vaccinated as soon as possible. Ladies and gentlemen, have a wonderful evening and thank you. Good night.
Thank you. Good night.
Thank you.
Thank you, everyone. Thank you very much for this information.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. See you.
Thank you. See you.
I already came here today. Huh?